1 in 5 U.S. adults lives with a mental illness, according to the National Institute of Mental Health. When was the last time you focused on your own mental health? It's something we all need to make a priority. So today we're going to take a break to do just that. We're talking about ways to take care of our mental wellness with Dr. David Gutterman with Cone Health LeBauer Behavioral Medicine. To start, what impact can not taking care of your health have on your physical health?
Well, it's important to just recognize the strong tie, obviously, between physical health and emotional health. You can have very, very good physical health, and if emotionally you are not doing very well, it can have a very negative impact on so many of your physical bodily systems. So it's important to really have a balance of health of both of them. So you can see all kinds of physical symptoms, manifestations when people have depression or anxiety. And if you already have a physical illness, having positive mental health can have extraordinarily significant positive results in helping you heal and work through those physical conditions.
So you mentioned anxiety and depression. What are some early warning signs we should be looking out for that?
Well, I think with regard to anxiety, for example, it manifests itself in lots of different ways, in various types of fears, excessive worry, in extreme forms, panic and social withdrawal, things like that. Now, we've all experienced at various times, some of these symptoms, but when they become more persistent and pervasive and start keeping us from daily activities that we typically would be involved with, that's when it becomes much more serious. With depression, you'll start to see signs of, again, social withdrawal, sadness, hopelessness, helplessness, feelings like that. We tend to sometimes think of depression of just being unable to get out of bed, but it's a broad spectrum. And again, people will experience sometimes, a bit of sadness or something like that. But again, when it's persistent and it begins to interfere with your daily activities, that's when it becomes much more serious.
So if we start noticing this and we think something's not right here, what should we do?
Well, if you're noticing it with a friend or a family member, certainly suggest it's something you want to address directly with that person. And generally, you do so in a very gentle way, just by kind of pointing out there's some differences. Again, where anxiety and depression becomes most notable is when there's a difference in someone's behavior. So they are no longer as social. They're much more withdrawn. They're not as interactive. Seem to be enjoying activities far less than, or engaging in activities far less than they ever have before. And you begin to point those things out. But you also do the same thing with a personal inventory for yourself. If you notice that I'm just not enjoying activities like I used to, I'm not engaging, I don't feel like, I have any motivation to do things like I used to. So there's a difference in your behavior. That's when you start to consider, seeking some professional consultation.
With school back, a lot of kids might be dealing with social anxiety. What are ways that parents can help with that?
Well, I think that's a great question, because at the beginning of school, especially, there's generally a lot of excitement among kids and among family. There's also some anxiety around just integrating into the new school year. But if you notice that your child, who normally would begin to engage in activities, seems to be just less interested in doing so, retreating to their room a lot more. It's challenging these days too, because so many kids again are engaging socially online and through social media, and you really want to try to promote more person-to-person, interactions rather than just electronic interactions. And I think there are a lot of social skills that have been lost these days because of that. So if you begin to notice that your child's less willing to engage in whether it's extracurricular activities, in activities involving other children, you want to begin to talk to them about that, about what some of their worries might be, and have an understanding of it first before intervening.
These days, it seems like everyone is carrying around so much stress. What are healthy ways we can manage that?
You're correct that people are carrying around a lot of stress. In my opinion, it's kind of hitting epidemic proportions. Our personal lives are complicated. You throw on top of that all the layers of things that are happening in our community, in our nation, in the world. People are very, very stressed these days, and we all have our own, again, unique stressors, and it's important to manage those stressors. As we said at the top of the segment, that strong combination between our physical and our emotional health, and stress is something that has a significant impact on our physical health. So it is vitally important to recognize when your less stress levels are getting more excessive, and it's important to rely on those things and think about those things that have helped you in the past, things that have helped calm you in the past. So identify where our stress is coming from, and to whatever degree we can, try to circumvent and work around those stressors. Some things we can avoid, some things we can't. But if it means being able to avoid some of those triggers for us, then you certainly want to do so. But you don't really want to rely on things like alcohol or other vices or things like that. Rather, it's important to try to expose ourselves to those things that have worked for us in the past.
If someone decides they can't do that alone or they need help with other parts of their mental health, what resources are there here in the Triad?
Well, it's important to know these days, especially, there are lots of different resources for face-to-face, counseling with a provider. But we also have virtual, LeBauer Behavioral Medicine, Cone Behavioral Health. Guilford County has behavioral health has resources where you can have both virtual as well as face-to-face counseling. In more emergent situations, of course, is 988 is an emergency line for more serious types of situations. But I think it's important to know that there is help out there, and to normalize the fact that sometimes just getting help through navigating some of the day-to-day stressors of life can be exceptionally helpful. And recognize that it's something not to be ashamed of. There's a lot of stigmas about getting help, but it's confidential. The resource is right here in our own community, and we make it as convenient as possible.
What is one thing we can all do today to make our mental health better?
I think there are a number of things, but if I pick one thing, I would look toward balance. Take a personal inventory. Am I doing the things? Am I optimizing my life in a way by surrounding myself with people and places and circumstances that bring me happiness? And do I have balance between work-life balance in the activities that I'm doing? We all are going to have stressors, but we need to balance that with activities and people in our lives that give us a positive outlook. And I think that's the one thing I see so often, is that people's lives get out of balance, and I think it's one of the best things you can do for both your physical as well as your emotional health.
Getting our lives back in balance, how do we start this mental health journey? Who do we call first for help?
Well, I think it's very difficult for people often just to reach out to their providers. It's ideally, if your medical providers, as well as psychologists and psychotherapists in the community. If that feels too overwhelming, talk to a trusted loved one or a friend, and generally, in doing so, you can begin to understand and again normalize some of what you're going through, and hopefully get resources. Most of us know people who have sought out counseling in one way or another, and you can get those resources. But starting with your medical providers, it's a wonderful way to get access into the mental health community.
Absolutely. Therapy changed my life and a lot of my friends and family. I hope that you get the help that you need. Thank you so much for being here. We appreciate it, sir.
My pleasure.